Hi, I'm Eliany Mejia, and this is Harvard TV, and we are covering the EP Science at ACC. So I'm here today covering all this amazing poster section. So tell me your work.
Yeah, hi, my name is Achilles Aiken. I'm one of the internal medicine chief residents at Cedars-Sinai. So we looked at delayed intrinsicoid deflection in sudden cardiac arrest cases. You're probably asking, what is delayed intrinsicoid deflection? Well, intrinsicoid deflection is essentially the R wave peak time. So it's the time from the beginning of the QRS to the peak of the R wave. And when it's measured in leads V5 and V6 of the ECG and is greater than 50 milliseconds, it's considered delayed and is consistent with delayed intrinsicoid deflection. So we were particularly interested in it because prior studies had showed that DID, or delayed intrinsicoid deflection, is associated with sudden cardiac arrest. So we wanted to see in those patients who've had a sudden cardiac arrest, what do the patients with delayed intrinsicoid deflection look like? What is their phenotype in comparison to patients who have normal intrinsicoid deflection time? So what we found was that systolic heart failure, coronary artery disease, and particularly ECG LVH was independently associated with delayed intrinsicoid deflection. And interestingly enough, though, the HFpEF group seems like has more normal ID time in the sudden cardiac arrest cases. So this looks like a slightly distinct phenotype compared to the majority of patients who have sudden cardiac arrest. And not only does it seem to be a risk factor for sudden cardiac arrest, but maybe a risk factor for these other cardiovascular comorbidities. Hopefully we'll be able to delineate with this, potential mechanisms that could lead to DID, and it looks like this might be multiple phenotypes, because although we have, a predominance of HFpEF in the normal ID group, there is a predominance of LVH in the DID group, and those are kind of discordant phenotypes, if you will. But right now, what we really use to, place ICDs for primary prevention of sudden cardiac arrest is, LVEF as kind of the sole marker that leads those guidelines. But only about a third of patients who have sudden cardiac arrest have a reduced EF, and only about a third of patients who have an ICD placed for primary prevention have an ICD that fires and hopefully prevents an arrest. So how can we identify other risk factors and markers to better provide ICDs for primary prevention, and maybe DID and other markers could be utilized in a risk stratification marker in order to do so.
I think that this is excellent data, pretty simple to different at 12-lead ECG.
Yeah.
So do you think that this delayed intrinsicoid deflection is a reflection of what we see in the myocardium, in the conduction delayed fibrosis? So that's actually it's an easy market to get in a 12-lead that is simple, that can extrapolate how healthy is the tissue, right?
Without a doubt. So we put a review together as well that looked at potential mechanisms in both human and animal models of what this delayed intrinsicoid deflection could be reflecting. And it seems like, conduction abnormalities, which are seen in ischemic heart disease, cysteine, in dilated cardiomyopathy or systolic heart failure, abnormal calcium and potassium conduction that, belongs to QRS, the action potential, and we're seeing it in this delayed intrinsicoid deflection, as well as scar. So, remodeling fibrosis,
the healthiness of the
myocardium.
tissue, the myocardium. Well, thank you so much.
Of course.
Really good data.